Today we're going to present critical aspects and solutions about different roles within sustainability in a healthcare setting. Let's present our topic. This challenge explores the often overlooked interconnections between healthcare and sustainability, with a special focus on undervalued roles and invisible contributions that are crucial to the system's functioning. These connections are not always obvious, yet they hold immense potential for transformation within the sector. By mapping the complex network of stakeholders and redistributing responsibility beyond traditional hierarchies, we aim to reveal where meaningful system-wide change can begin. Understanding this hidden landscape is key to transforming sustainability from a peripheral effort into a core value embedded in everyday healthcare practice. Now we're presenting our first critical aspect and its solution. Valuing the unseen. Sustainability in healthcare is often treated as a secondary concern, disconnected from daily operations and excluded from the core strategies that guide hospital management. Yet, behind every hospital's successes, there are essential figures such as distributors, technicians, operators, and repairers who work behind the scenes. These professionals play a vital role in ensuring that healthcare systems run smoothly and efficiently, but their contributions are rarely acknowledged or included in sustainability efforts and key decision-making processes. By recognizing and integrating these hidden contributors into the conversation and embedding sustainability into all roles, we may unlock their full potential to drive the change. One of the answers to this critical aspect could be empowering sustainability ambassadors. To make sustainability a core element of healthcare, it must be integrated into mandatory education, job roles, and organizational structures. Role-specific sustainability training for clinical, operational, and managerial staff, from onboarding throughout professional development, can build shared responsibility across the system. Updating job descriptions to include sustainability tasks and adopting procurement policies signal real institutional commitment. Cross-functional green teams and sustainability ambassadors can foster collaboration, whereas regular interdepartmental meetings and internal platforms help align efforts and spread best practices. These combined strategies can shift the sustainability from a peripheral initiative to a central, everyday practice in healthcare. Now let's focus on our second critical aspect. The role of patients is often underestimated within the hospital system, since they are placed at the bottom of the hierarchy. They are frequently seen as passive recipients of services and care, rather than active participants in their own health journey. As a result, patients are rarely involved in decision-making processes, which can lead to widespread sense of frustration and disconnections within healthcare environments. To foster a culture of mutual respect, it is essential to elevate the role of patients across the entire system. This means building a relationship that is no longer one-sided, but based on involvement and reciprocity. Creating opportunities for patients to express their needs and preferences can enhance both their experience and clinical outcomes. The emotional sustainability of both patients and healthcare professionals can then be nurtured throughout a virtuous cycle of trust, empathy, and collaboration. What we suggest is a training for empathy. Providing healthcare professionals with training in active listening and empathy can significantly improve patient interactions. In Italy, for example, nurses often receive formal training in psychology, including specific exams, as a part of their education, whereas doctors typically do not. This creates a gap in emotional preparedness among staff, even though doctors are often the primary point of contact for patients. Extending psychological and communication training to all medical roles could help ensure more balanced and emotionally sustainable care. In conclusion, emotional competence should be recognized as a core clinical skill, essential for delivering truly human-centered healthcare, since sustainability is not only environmental, it is also emotional, relational, and human. So, sustainability in healthcare should be considered in a broader sense, including organizational and relational aspects. Recognizing the role of less visible professionals, involving passive figures more, and supporting the emotional skills of healthcare staff are all important steps toward a more cohesive system. These principles can be gradually integrated into training, policies, and daily routines. Rather than relying on isolated efforts, a coordinated and inclusive approach may help make sustainability a more concrete and consistent part of how healthcare is delivered and experienced. Thanks for your attention.